Dr. Rao, what is chronic constipation and what causes it?
Chronic constipation is a bowel problem, primarily affecting the large bowel or the colon. And most of us define this in terms of either irregular bowel habit or difficulty with bowel movements. And by word chronic, we mean that this condition has persisted for at least 6 months or longer. And this is to compare with what we called as occasional constipation, which occurs to every one of us. Sometimes we travel, our work schedule gets ahead, we're not eating properly, and so on. So some of these lifestyle changes do affect how our body works, how our bowels work. And so they can have an effect, and our bowel habit may become irregular. But when we refer to chronic constipation, we're really defining that problem where these symptoms have persisted for 6 or more months, and then it can either be an irregular bowel habit or a difficulty with bowel movements. Then you ask the causes of constipation. So here I usually tend to divide this into multiple subtypes. There is something called primary constipation, which means that the problem is in the colon or anorectum, which is the opening from which the colon empties. And it's either in the muscle or nerve or sensation of these organs. That is a primary disorder within the gut. Then you have secondary constipation. Secondary meaning that the constipation has come about because something else has changed. Now, this can be, for example, a person has started taking some drugs. There are many drugs that are constipating. For example, opioids, which is commonly used as pain medications, antihistamines that we take for allergies. There are many blood pressure medications that people take for blood pressure, but then it causes constipation. Then heavy metals, such as iron particularly. If you are anemic, you take it, that causes constipation. Then there are certain metabolic conditions, such as diabetes or hypothyroidism. They're very common causes of constipation. And likewise, many women during pregnancy, about a quarter of women become constipated during pregnancy because of hormonal changes inside their body. And there are rare conditions such as neurological problems, such as Parkinson's disease, strokes, connective tissue problems like rheumatoid arthritis, and so on. And they all are common causes of constipation. But these are causes that we would put under the category of secondary causes. In other words, if you take care of the drugs or you take care of Parkinson's disease, then the constipation will improve. Then the third category I put is traveler's constipation. As I said, this is usually self-limiting, short-term constipation. And last is really the opioid-induced constipation, which is really a new crisis that has come about in most of the Western countries because of the excessive use of opioid medications to help relieve pain. So these are kind of the broad subtypes of constipation. But there is one term that I want to mention, and that is called CIC, or chronic idiopathic constipation. Now, this is an old term. Idiopathic means unknown. Now, we only apply this to conditions where we really don't know. And yes, it is possible that in a small group of patients, maybe about 10% or less than 20% of patients, we really don't know why they develop constipation. But in over 80 to 90% of patients, we know precisely what's causing constipation today with the help of modern tests and tools that we have. And we can identify the problem, and then we can treat it based on what we identify as the cause or the condition that is leading to